morning. My name is Mean Cano. I'm your teacher, yoga teacher's trainee at Daily Prana. Today, I'm going to discuss with you the anatomy of the spine, its function, and what are the problems we encounter in our spine, how do we identify it, cause, and how, as a yoga teacher, can help students with their back problems or spine problems. Okay, what is a spine? A spine is a bone or a muscles or a tissue that reach from the base of your skull down to the tip of your tailbone. It serves as a central support structure that helps you in different musculoskeletal system, in your musculoskeletal system. That helps you with bending, twisting, running, walking, and bending. As we age, our spine experience wear and tear due to improper posture or old age. Back injuries and other spine problems can damage the spine that can cause back pain. There's no such thing as a perfect spine. It's just that it's just a human nature that everyone can just adapt. Some of the spine are wavy, some of the spine are protruding, some of the spine has a problem with the spine sometimes at the lower back. So there's some of the other people, it's just normal for them to have a wavy spine. Okay, so going back to the cervical spine, it has 7 vertebrae and 8 spinal nerves. It is found in the upper body here from C1 to C7. All right. Only the smallest vertebrae with foramen, small holes where the vertebrae arteries passes. Vertebrae have short process except C7 and are often fabricated or split into two like a lizard tongue. Okay? What is fabricated means? Fabricated, it's split into two so that it allows you to have a great range of motion for a greater mobility. Small delicate and injuries are more severe. Okay, so we also have the thoracic spine or ribs. It's found in the midline or the middle part of your spine. It is a least mobile, least prone to injury. There are 7 true ribs, and costal cartilage connects them to the sternum. 5 false ribs, 3 connect to the costal cartilage above. The two are just floating. Okay? And don't connect at all. In every 200 to 500, an extra rib is at C7. Okay? It is more common in women. Third, we have the lumbar spine, which is located in the lower back. It is the most weight carried, lots of movement there. It's a hinge of the spine. If something is going to give you, or something that is going to give, it's going to be in that region. So most of your weight, it is carried by this part of our spine, which is the lumbar spine. Next, we have the sacral spine. It is from the L5 to S1, which is the hot spot of all back injuries. S1 can also be a big problem, and it is also completely immobile. So you cannot. For some people, back pain will naturally move down to the S1 joint instead of L4 and L5. We have also the fossa muscles originates from T1, L1 to L4. It crosses to pelvis to femur, inserts at lesser trochanter of the femur. This is the tenderloin. It is the strongest flexure of the hip joint, but since it originates at the spine, hips and spine are forever connected. Okay? So often referred as the iliopsoas because the iliacus muscles and the fossa pair up at the pelvis, both insert at the femur. Okay? So, what are the do's and don'ts posture in yoga position? So look, we always look for the postural abnormalities. So we don't give unsolicited diagnose because we are not doctors. We help the students correct dysfunctional movements, and we don't give label to the student if they have lordosis, scoliosis, or kyphosis. We always keep our student safe, and we don't scare our student from the exercise of the movement in the yoga. Which is, if we know that there is back injury or back pain, we just always modify the position for them, right? So we have the spinal traction. Traction is a natural way to decompress the spine, usually through some type of conversation, yoga trapeze, and gravity boost intervention table. During sleep, you experience gentle tractions, and that create much 0.25 inch of extra space. If you have back pain, this is very good. The spine is extremely complex, and worthy of study and investigation. So, to identify the common problems in that spine and why it matters, because the reason why we have to identify the common problem, it is because we have to be familiar of the condition of our students so that we know which specific position in yoga can help them or cannot help them, right? The common terminologies or the common condition that the student have with their spine is disc herniation. What is the disc herniation? More of this herniation is a squeeze or bulge, but often referred to as a slip disc. Okay, so what happens with the annulus fibrosus is damaged, and the nucleus pulposus is squeezed out. So that's what happens if the annulus fibrosus is damaged and the nucleus pulposus squeezes out. Slip disc is the problem. What happens is there is a continuous pain, which is very common. It might irritate the nerve and it radiate. Could even cause bowel and bladder incontinence, or it affects the nerves. Okay, so we have basic terminologies for you to understand easier of the common conditions that you can encounter in the spine problems, which is the spondylio, which is the spine, osis, which is the pathological condition, lysis, which is the break, and listhesis is the slippage. Spondylosis is a generation term for degradation of the spine. So that's, if your spine is already degrading, that's spondylosis. Okay, if your spine break or fractures at pars, that's what you, or part of the joint, that's what you call spondylosis. We have also the spondylolisthesis, which is slippage of the vertebra, usually interior part, which is sa loob na siya, which is inside. Okay? Spondylosis normally is a wear and tear condition due to improper posture, due to aging. This caused by constantly improper posture or poor posture, dysfunctional movements when you are getting older. This what happens if your disc is degenerated already, fractured disc, or nerve irritations. These are the result if you have a slip disc or spondylosis. You have a nerve irritation. Okay. Spondylosis is mostly common and can be symptomatic. So if you have this, you can identify if you have that because you can feel the symptoms. Right? We have the spondylosis. Spondylosis is the bony defect or fracture within the pars interarticularis, typically caused by stress fracture of the bone. So if there is a fracture already or stressed on the bones, that is spondylosis. Common in adolescent who overtrain, just like the athletes. Most common in lumbar region, which is the lower back of the body or the lower back of the spine. Treatment could be either surgery, bracing, physical therapy, or nothing at all. Can also progress into stenosis or spondylolisthesis. Okay? So spondylolisthesis is slip vertebrae or slip vertebra. It's forward displacement of vertebra, usually in lumbar region or cervical spine, which is the upper part of our body or upper part of your spine. It's also very rare. It happens very rare in our thoracic spine. The cause of this is fracture, of course, accident, trauma. And less common cause is the birth defect, tumor, and infection. When you have spondylolisthesis, body will often try to self-fuse by calcifying ligaments. Fusion surgery might be needed. And spondylosis, fusion surgery might be needed. We also have the spinal stenosis. The spinal stenosis, if the spinal canal is narrowing. So, various causes, cervical, lumbar, spine most commonly affected. So, sa spinal stenosis, the common affected area which is the cervical spine. Okay? Often age-related to wear and tear on this area. Many causes ligament thickening, bone spur, bulging disc, facet joint problem, compression, fracture, or cysts. Note that the cause, it is caused by genetically small vertebrae canal. So it is a narrowing, spinal stenosis. We have the facet joint or the facet syndrome, usually in a cervical or lumbar at the joints, cervical or a lumbar at the joints where vertebrae meets.